Good evening, everyone. Welcome to another session, Open Conversations with Sisi Alero. We're going to be having the amazing Tanya with us today. Um, just going to wait for everyone to join in. I hope we've had a lovely day today. This is April. April has been about adenomyosis awareness. So we have the best person to have a conversation with this month, and looking forward to her joining us and kickstarting this evening. Where is everybody? Hi Tanya. I get this every time I go live. I have to do about 3 times. Yeah, I do it about 3 times before it lets. Do you want to send it again? It's not letting me do it as well. It's not letting me add you. I've sent you an invite now. Finally.
Hi.
Hello. How are you?
I'm fine, thanks. Let me turn up the volume. Right, that's better.
Can you hear me okay?
I can hear you loud and clear now.
How have you been? I know you're very busy and everything. Thank you for making out time to join in.
It's okay. Yeah, I've been all right.
Yeah,
Excuse me. Yeah, lots of things happening and going on, but I've been good. How have you been?
I've been good. I've been good. Been good.
Good,
Yeah.
good.
So where do we start from? Do you want to start by just telling us briefly about yourself, who you are, just about Tanya? Who is Tanya?
The period lady. I'm Tanya, and I'm the founder of the Adelo Gang. We predominantly campaign, advocate, and support for those with adenomyosis. But we also teach menstrual health workshops in schools and colleges. And I go and speak in organizations and also offer menstrual health training to HR and senior leaders. Tanya is a mum. That's all I can really say. I don't really know who else I am. I'm a mum to a 13-year-old child, boy, got a teenager.
Mm,
Um, I'm a professional face painter and I'm a bit of a creative. I like to be creative. I like to make things.
that's great. That's great. It's nice to know the Tanya outside of
The
Adina.
Adeno guy. But I
Yeah.
think Adeno consumes most of my life because I'm always talking about periods all the time. Like my partner, he knows a lot about periods. So does my son, because I'm always talking about it.
No
So
choice.
yeah, they've got
No
no
choice.
choice but to learn.
So
They
can you
probably
just,
know more than some women, to be fair.
which is good because we really want more men talking about it as well. So it's
Yeah,
it's amazing when you find men that are really interested in knowing what it's about. I mean, it goes a
I
long
don't think
way.
they're interested. I just think they've got no choice.
That's a different way, isn't it? But then again, they can actually talk about it now, so that's a
Yeah,
good
no, they
thing.
can. My
Yeah.
13-year-old child can pronounce adenomyosis and tell you what it means.
Amazing, amazing, amazing. You're doing well. You're doing
Thank
well.
you.
Yeah. So
Thank
do
you.
you want to like tell those who are going to be listening what got you into talking about it?
When I got diagnosed with adenomyosis, it was just a phone call. Hi, Tanya, you've got adenomyosis. It's nothing to worry about. And for me, that was too much of a blanket statement. So I began to research more. And then I found out that adenomyosis is not rare, it's just rarely spoken about. And if you scroll down to the bottom of the Adeno Gang page, you see the first action that I did when I did the page is I found women around the world who had adenomyosis, and then I got them to send me their picture, and I made a I have adenomyosis frame and put all the pictures of various women all across the world. So we had Australia, Canada, there was everywhere, Africa, there was everywhere. And
Yeah,
that's
because
what prompted me to start.
yeah, because I remember seeing you when I was researching, seeing the Adino gang, and I was like, okay, so I'm not the only one because I was feeling like I was going bonkers everywhere I went. Research, everything I was seeing was endometriosis. I wasn't seeing anything about adenomyosis. Even at
Yeah,
that point, I
neither was
didn't even
I.
know I had endo. Yeah, so it's a term or it's a condition that people don't really know about. When I'm trying to describe it, they're like, "Oh, is that endo?" And then no, it's not endo. So even when you say adenomyosis, they reply with saying endometriosis. So
Yeah.
yeah, you've done an amazing thing there. Well done.
Oh,
Well
thank
done.
you.
Yeah.
Thank you.
So I noticed that you're also going into policies and all of that. So do you want to talk about that part?
Yeah, we're currently, the Adeno Gang is going to be the secretariat for the Menstrual Health APPG. So we're just going through the final points of our all party parliamentary group. We actually have a chair who has
Mhm.
adenomyosis, an MP. She has
Okay.
adenomyosis, yeah. So this is how we connected with each other.
Mm.
I'm also a stakeholder in the women's health strategy, so I've been a part of the conversation for that. I attend the Women's Health APPG quite often, informed choice, and I am also part of the steering committee for the Menstrual Health Coalition.
Okay.
So those
That
are
is a
where,
lot of work you're doing.
yeah, yeah. It's tiresome, but I think I need to be in the right places with the right people to make
Definitely.
real impactful change. Like,
Mm.
yes, I advocate, yes, I campaign on Instagram and in, I guess, a public forum, but a lot of the change can take place in Parliament. So,
Parliament.
yeah,
Mm.
I'm always in Parliament. Actually, I like it there. I like it there.
And do you think the changes are coming?
Yeah, slowly, slowly, they are coming. It just depends on what part of women's health you're looking at.
Mm.
Obviously, like there's ICBs, which are integrated care boards, which are all about women's health hubs that's been introduced to help. So a woman should just have to go to one place. So whether it's to get the pill or to get her coil fitted or to have a mammogram or to talk about having some maternity services, everything should be in the one place, or if they're gonna go for menopausal stuff. And there's just like quite a lot of things that I feel like need to be highlighted that a lot of people don't know about, like community gynecology and stuff like that. There's just so much things going on, and I think when you're just a patient in the space, you don't realize that there's so much things going on. But there is things going on. There will be change, but there's a lot of fight that has to happen for that.
Happen.
Yeah.
Uh, Amazing. I'm terrible with politics, so I always wait for the breakdowns and understand them. But yeah, you explained it perfectly. You've explained it perfectly. So recently, adenomyosis has been put on the NHS England website. I was talking to a few people and they didn't even know that I was there. And for some people, they don't understand it. So like when if for instance someone who's just found out that they have adenomyosis and they go on the website and they read it and they're confused, what would you suggest that they do to get a better
Come to my
understanding?
website. Come to the Adeno Gang website.
Of course,
We've got
I
more
always tell people to that
information
anyway.
on the Adeno Gang website than unfortunately is on the NHS England website.
I know.
But I did speak to somebody from the Department of Health and Social Care,
Mm,
and they're responsible for that. And I said to them that we need to change it to add the fact that there are different types of adenomyosis, because I think that's important
if-
for people to know, because that depends on the type of clinical pathway you can go
mm,
down.
mm. Yeah, because it's kind of just really, it's just a basic headings over there, and yeah, if you don't know anything about it, you're just gonna be like, okay, you might just think it's nothing to worry about actually. But yeah,
Well, in some people, I guess 1 in 3 people who menstruate have don't have symptoms.
yeah,
So you could be walking around with adenomyosis and not really know that you've even got it. So
hmm,
swings and roundabouts. I just
I
think
know, yeah,
more information needs to be highlighted, and I'm pretty annoyed at this month as well, because where's all the noise? All the noise that was
nothing,
made for
nothing,
endometriosis. Where is everyone? Now, don't get me wrong. I suffer from endo too. I got
yeah,
bad endo, but the conversation is always very much endo led, and I don't like that.
yeah,
Why are we leaving out adenomyosis? I feel
yeah.
like if it wasn't for Naga Manchetti,
You won't even hear anything
adenomyosis would still be would be further back
behind.
than where we
But
are
I
today.
mean, fibroids is even known more than adenomyosis.
Yeah, it is.
It's like it's
Everything's
my
no more.
yeah. My birthday is in a few weeks, and every time it's coming towards my birthday, it will say, what charity do you want, and when you click on it, you never find adenomyosis. I type and type every single year if it's going to come up. No, there's nothing. It's just endo. I don't know how else we can change that, because it needs to be out there for people to know that, you know, this condition is not something to just look away from. I'm not saying we need to give it, but at the same time, people need to know that this is something you need to check for yourself. Make sure, even if, because I know someone who has it, and she doesn't even, like, when I'm talking, like you said, some people don't have severe symptoms, so they just walk around. But recently she's been having like changes, and they found out she's got adenomyosis. And she just feels like, there's nothing. So what else can we do apart from, what else can you, how do I put it? Like, you have it, the doctor has told you, but they don't say anything. And how do you get the doctors to explain better to you, like on the first time you find out, because not a lot of people know how to navigate getting the
Not a lot
information.
of
Like,
doctors know how to navigate though, so it's really a thing of the luck of the draw. It's really about the luck of the draw and the doctor you get. Because when I was first told I was dismissed, well, it's nothing to worry about, and it's not until I researched and then I found additional doctors maybe to give me more support. But you just have to do the research,
good
unfortunately, and that's
research.
so bad to say. Do the research. Go to my website, type in
Yeah.
adenomyosis as a hashtag on the gram, and look
Mm,
through the gram
yeah.
and see who you can
It
find.
would
Because
definitely be, yeah.
I'm not the only advocate or campaigner for adenomyosis, but
I know.
hardest. But I feel like I am going to be bringing back the adeno space, which is the support group. But at the
Mm,
same time, I have my own things going on and my own health issues. So, like,
yeah.
I was due to have surgery next week, but I'm not having it. Yeah, I'm not having it.
I was going to say, did you decide to have surgery?
No, I'm not having it. I told them
So
no,
why are
I
you
don't
not?
want to do it.
Is the surgery for
Um,
endo or?
Just for endo, nothing to do with removing any adeno.
Yeah,
Even though I have come to find out that I can have an adenomyomectomy,
yeah.
which is the same as a
As
fibroid
having a fibroid
myomectomy,
myomectomy. Yeah,
but obviously it's called an adenomyomectomy, and the only
yeah.
reason I know I can have it is because it's for women with adenomyoma, and the type of adenomyosis I have is
Depending, I was gonna say.
adenomyoma. And
Oh,
this is
okay.
why I think it's very important that women are told what type of adenomyosis they have, then this can determine on what options and clinical
Yeah.
pathways. But for me, my issue is I I'm supposed to have a laparoscopy. I've got bowel endometriosis. My ovaries are stuck to my pelvis as well. So I knew about these things, and that's what I thought I was having the surgery for. When the letter came through, it said I'm having a laparoscopy, a pelvic laparoscopy, removal of endo, and they're also going to remove the bowel nodule. But then that's what it said on the letter. But when I went into my care app, it actually said that I'm going to have something called uterolysis. I was never explained about that.
What's
And
that?
that means, so basically, the tubes that carry your urine from your bladder to your kidney, they need to
Mm.
be freed and lifted up. But I wasn't discussed about that. And also, the surgeon that was doing my surgery, I'd never met them or had an appointment with them. So, as far as I'm concerned, why am I going to let you cut me open if I've never met you
Yeah.
before?
And
He
it's
is
a
the head.
total. That's a
He is the
total
head of the
different surgery.
department in a hospital, which is fine. So my surgery would have had a gynecologist, a urologist, and a colorectal surgeon.
Oh wow, that's a total different end. So if they were going to do that surgery, they're going to do that along with the other ones, or it's
Yep.
just a different.
No,
Oh wow,
altogether.
altogether. So that means your what did you call it? The urine ure ure. I always find it difficult to pronounce that.
Ureters.
Urethral.
Ureters.
Yeah. Is it the
Yeah.
ureters you're talking about? Oh, I thought it was the one for the urine.
Yeah, yeah, the ureters.
The ureters. Yeah.
Yeah,
So
so
it's
that's the
stock as
tubes
well.
that
Does that
carry.
mean it's stock as well?
I guess so. I don't know. They didn't really explain it to me properly. This is why I'm not having it. This is why I'm not having it.
That is scary. I mean, when um I had bowel endometriosis and I could feel something was wrong, even like opening my bowels and all of that. So I knew something was wrong. But when I did the colonoscopy, they couldn't find anything. They only found two polyps and took that out. So, well, you know your body, you know something is it's not right. So I kept saying something was all right. So they did another test, and then they found out I had, and it was gone so bad, and they were like, oh, 50% chance you're gonna have a stomach bug. I was like, no way. So
Yeah,
I
see.
can't imagine if they had told me that last minute. I don't know how that would, because I even took a long time to, play it out in my head to think about it. Do you really want to do this surgery? But I got to that point where I was just tired because I had diffuse adenomyosis and it wasn't getting any better. You know how it is. It's not like there's anything to help it. You can manage it, but you can't heal it. Well, I don't know anyone that's healed it yet, but yeah, I would like to see someone that's healed it. But living with that pain and then added to endo with it, it was horrible. So I can't imagine how you're feeling. I know I've seen you when you had the pain, and yeah. So you decided not to have surgery.
I'm perimenopausal anyway, so I've been riding the pain for how many years? Let me just keep on going
Keep going.
until my
That's fine,
period
but
comes, and then I'll be saying, "I just want the surgery."
yeah,
Yeah,
well, but it did say with that, when you have menopause, it stops, doesn't it? So
we'll see.
we'll see.
We'll, yeah, we'll see. They say these things, but
They
what do they
say, well, we
actually
haven't
know?
seen anyone yet that has, come out to say, after this has happened. Yeah, I did try to wait to that end, but I couldn't anymore. It was draining me. It
I hear
was
you.
draining
You've
me.
got at the end of the day, people have to do what is
What's
best for
best?
them
Yeah,
and how it's going to improve their quality of life. So If a hysterectomy is it, a hysterectomy is it. If surgery
Yeah.
is it, surgery is it. But you know what works for some doesn't work for others,
For
or people
others.
are
Yeah.
comfortable enough
Yeah. I just didn't
to.
want to keep going back and forth surgeries. I like, I must say, I must confess, it's been amazing.
You might can imagine, no pains. What?
I think I've bled enough for my lifetime, anyways.
Yeah, you bled enough, wombs removed. It's all good now.
Yeah. We just get the little bits and bobs now. There's always a side effect with all these things, though. They don't talk about
Mm.
them. I'm going through them
Yeah,
and I'm slowly, I'm
yeah.
slowly
They
trying
don't.
to,
They don't talk
yeah,
about the fact that when you have a hysterectomy, you then get put into menopause. They don't tell you that. No, they
yeah,
do tell you, but they don't explain to you the
explain.
implications that
That's
this
it.
can have on your life.
Mm,
So, but I've gone into perimenopause, so
you're getting
I'm
there.
alright. I'm getting there.
But
Yeah, I'm
then again,
dated. I'm
you
day
don't know how
88.
long that will take.
Well, I'm day 88, so I'm on the countdown right now, and I hope it just continues, to be honest.
Could be another 15, 20 years, but
No, no, no. I'm on the way. I'm day 88. Yeah, there's only 200 and something days to go. We're gonna keep it this way. Keep going.
well done, well done. So, apart from all of this,
So,
do you work? Do you work or you're fully focused
this is my
on your
full-time job.
gang?
The Adeno
That's your
gang is my
full-time job.
full-time job. Yeah,
Wow. Wow.
yeah. I don't have another job. This is my job.
That's like you working 24/7 then.
Yeah, kind of. Kind of. Kind of. I don't know. My partner would have to answer that one. It's kind of
Well,
working 24/7.
as long as he's not complaining, I'm sure everything is okay.
Yeah, he's
Yeah.
just, I think he just grins and bears it, to be honest.
Mm.
Yeah, babes. He said, mm-hmm.
Yeah, I saw um your award you got from a rising star and going into speaking. How is that for you?
Um, the Rising Star wasn't the first award I won, but it's always nice to be awarded and acknowledged
Yeah.
for your work.
Hmm.
So that's really good. I think we are in the same category for the She Inspires Award. Me, you, and Dawn are in
Oh,
that category.
nice.
Agent of Change.
Yeah,
So yeah, it's always nice to be acknowledged and recognized.
it is.
Um,
It is.
and speaking, yeah, I like to speak, and what no better than to speak about adenomyosis and menstrual health.
Mm, yeah. You're natural anyway. So when I saw you going for the class for the what's it called again? It keeps going out of my head. You know where you went for? Um, their names have just got off my head.
I'm not sure what you're talking about.
The is it Brian and his wife? Is it Brian?
Oh, Byron and Bianca.
Byron. Yeah,
Oh,
yeah,
yeah, they're my mentors.
yeah. When I saw you there, I was like, she doesn't need this. She's already good.
Mm, that's for the business aspect, I guess.
I
That's
know you
why.
have to. Yeah, I know. I know.
Yeah, yeah. But yeah, they are my mentors, so
Yeah,
that's why you would see me with
they're
them
really good. I've been
around.
following them for a bit. Yeah, yeah.
They are,
So
they are.
yeah, when are we going on our TED talk?
Unfortunately, I didn't get shortlisted for TED Talk NHS. But I didn't think I would because Molly Fenton did the similar TED Talk last year, so I didn't think, and I
Oh,
went to
so
go
they
watch
didn't.
her. So I
Okay.
didn't think they would take me
Another
because
person again.
it's the same topic she spoke about, periods. So I just have to try some other TEDx's, to be honest. But that was the TEDx that I wanted. I did want TEDx NHS, but there's many TEDx's, so I'll just
But
pick
it
one
can
of them.
never be too much, though, can it?
Yeah, it wasn't for me, I guess.
Yeah,
Excuse me, what's for me will never pass me by. So
true. Yeah.
yeah,
So the other ones to try. One of them will pick you.
yeah, yeah,
I'm
yeah,
waiting.
yeah, yeah. I might
I'm
go for
waiting.
TEDx London.
Yeah.
Yeah,
We're rooting for you. We're waiting.
thank you, thank you. I expect to see you there in the audience.
Oh, definitely, definitely,
Thank you.
definitely. Yeah. So, um, what do you do for your downtime? Don't tell
Mm,
me you don't have a downtime.
I don't know what I do for my downtime. I like to roller skate. I ain't got my roller skates for a while. Um, I like to be creative. But I like to sleep. That's my downtime. Is that all right, babes? He tapped the pillow, so that was. I like to sleep in my downtime.
Yeah.
Yeah, I
Hobbies?
don't.
Do you have?
I like being creative, so I'll make t-shirts, jumpers.
Oh, nice.
Um, I'm a face painter as well. I'm a professional face painter, so I like to
Wow.
face paint. Um, but that's about it.
I can't call that hobbies. That's like you working.
The hobbies is my work.
Okay.
I don't
We'll
know.
have to take that. But you need to have a hobby. You need to have something that you can enjoy, relax. Do you enjoy traveling? Do you enjoy? No?
Really, if I go on holiday, I go on holiday. Obviously, I'm gonna like it, but it's not like I have to do this. I don't know. I guess I work a lot. That's what this your question has shown me. I don't really have an answer.
You need one. You have to think about something after this. Something to reward yourself with. Pat yourself on the back and say, yeah,
I don't know. I like hot stone massages, so yeah, I guess that will do.
how to.
I don't know.
You really do need one. So, um, if there were, let's just assume we have young girls and women sat in front of you right now that want to know more about the adenomyosis, what would be the go-to for you to tell them?
Go to my website or my Instagram page. That would be what I would say.
Okay,
Like I feel like
let me rephrase it. They're sat in front of you. They're feeling ashamed. They're feeling embarrassed. They don't want to talk to anyone, and someone has recommended them to come to you to speak to them. What would you say to them?
that they're not alone. You're not by yourself, and there's thousands of us all going through the same thing. Yeah, and just take each day as it comes and try to support yourself the best as you can. I think what's important when you're diagnosed with any of these conditions is to do research. Research is key. Understanding where you are, what stage adenomyosis, what type of adenomyosis you have, then you can go off there to lead for the rest of your medical care.
Fantastic, thank you, and also go to her website. So, if I gave you, or if you had one wish that was going to be granted, just one, what would you
Yeah,
wish for?
to end poverty. That was such a world. What's it? What's that? Miss Universe answer. I hope for world peace. No, but to end poverty, that would be my one wish. Because if there was no poverty, then everyone wouldn't be chasing for to be rich, would they? And those that are
Yeah.
less fortunate wouldn't be less fortunate because we'd
Less
be level
stress.
playing. Yeah. You seem surprised that that was my answer. What did you think I was
Yeah.
going to say?
Yeah, because every time I ask that question, people just usually, it's always about self or about ending adenomyosis or a solution or a cure for adenomyosis or whatever it is we're
There's a
talking about.
cure, but there is a cure for adenomyosis. It's just unfortunate that it's a
It has
hysterectomy,
to be a
there is,
hysterectomy.
but there is
Yeah.
a cure for it.
Yeah.
Like I could say, oh, I wish adenomyosis was taken more seriously or something like that, but that's only going to help a small portion of people.
Of people.
Ending poverty is going to help a lot of people. If I could have one wish.
Yeah. Yeah. I mean, when I did the UN Women 69, the CSW 69, I went on the poverty team because I feel like um, when it comes to young girls and women, you know, period poverty, there's poverty really. It's especially if you're a woman or a girl, and then you don't have the resources to buy your sanitary towels, you don't have the resources to eat right. All of this, that's why I look at it, the menstrual health in itself, with the well-being and everything. Because if you're not eating right, your periods are not going to be right. If you're poor, you don't have enough resources, you're going to be stressed. Stress will trigger your periods. So it's all kind of linked, isn't it?
Yeah.
So it all boils down to that, the fact that there's poverty and it affects the girl child and the women a lot. So it's that's my area that it really gets to me. Yeah, that was a lot. That's why I was surprised you actually said that, because I was thinking you're going to say something to do with healthcare. But yeah, it encompasses everything.
If I ended poverty, then people would be able to afford period
Everything.
products.
Yeah, yeah, yeah,
I wish everyone would be educated on menstrual health, and then there was a level of education for menopause, because the next step ain't for the faint-hearted.
I know. I know. It's this and this, isn't it? Menstrual health is here, menopause is here, because you start from here, kickstart slowly come to this end. And you don't have enough information for this, you don't have enough information for this. So,
Yeah, there's a gap in
uh,
knowledge.
yeah. And we're learning, we're still learning. I'm still learning, to be honest,
Me too. I learn every day.
every day.
Like, I don't know everything there is to do with
Mm.
adenomyosis. Like, I literally only learned about adenomyomectomy.
Myomectomy.
Yeah, I only learned about that about 2 months ago, I think.
Oh, wow.
And I was at a event with some doctors, and the doctor mentioned it, and it was all very blasé, and I was like, what is this? I've never heard of this before. And I was with Dawn, and we both looked at each other like, huh? Adenomyomectomy. Like, we know a myomectomy is a fibroid operation, but
Yeah,
we do know the similarities between adenomyosis and fibroids anyway. So it
yeah.
doesn't actually surprise me that there is an adenomyomectomy.
hmm Yeah. When I found out about it as well, I was like, oh, why didn't I? I found out last year, but I found out after my surgery.
Mm.
So I was like, why didn't I see this?
But you wouldn't have been able to have it anyway because you got diffuse adenomyosis. So
Yeah, but it's
that's
just
not for
what people
you.
will, yeah, because it has to be in a particular, like adenomyoma, just they
Yeah, it
can take
has
it
to be
out.
adenomyoma. Yeah, and
And
this is why it's important that.
also depends on on the type of adenomyoma, isn't it?
Yeah, there's only one type as far as I know.
No, I mean if it's really what's the word, like I can't remember how it was written, like if it's too big or something, like the size depending on
I
where
don't
it's
know about
located.
I
The
don't
size
know
where it's
about the
located.
sizes. I couldn't tell you. I can only tell people that this operation is available for those with adenomyoma, and they need to discuss it with their healthcare professional because
Yeah.
we're all different, and
True.
depending on the adenomyosis. And I have met women that's had more than one type of adenomyosis. So they've had
Mm.
diffuse and adenomyoma. So
Yeah.
I don't know what the workaround would be for that.
Mm. True.
Because like for diffuse, I guess you can have a OSADA, and they don't really offer that treatment to people either.
Yeah.
Lillian has had it. She was the 28th person in the UK to have that surgery for adenomyosis. And then Nadine had a UAE for her adenomyosis. So, and Nadine's got diffuse. I'm not sure what Lillian had, or has, I should say.
And it worked well for them.
I think so, yeah.
Mm.
I can't really speak on behalf of them because they might have something different to say now, but I think so.
Okay. Okay.
Yeah.
Yeah. But it's really good to know that there are different options, and it's being put out there. It's making people understand that it's not just, you don't need to go straight into hysterectomy. You need to find out about other options.
Yeah, no, there's other options. This is why I just make sure that I put the information out on the Adeno Gang, and then it's
Yeah.
for individuals to go and do their due diligence and bring these
Yeah.
things back to their healthcare professional. I'm
Yeah.
not telling anybody to do them. I'm not telling
Oh, no, no,
anybody
no,
not
no.
to do them.
No.
I'm just letting them know that what is available for
Yeah.
you to have, which could potentially be an option, but we never know. I don't think we're educated enough. And to be honest, some doctors ain't educated enough because
I know.
my own doctor didn't tell me I could have an adenomyomectomy, but I found this out from fibroid specialist doctors. That's who told me about the
Really?
adenomyomectomy. Yep. Yeah.
There you go. Yeah. Thank you so much for your time. Is there anything else you'd like to let us know or tell us before we let
Um.
you go?
No, just look out for our menstrual health APPG, which is an all-party parliamentary group. We'll all be launching soon, and we will be tackling all kinds of issues to do with menstrual health, and especially I'd like to look into black women and menstrual health because in the UK it's very, very under researched. So I just think, yeah, and then more work needs to be done.
Lots of work.
Yeah.
What happened to our adenomyosis brunch, by the way?
I'm trying to figure out a place still. Even though it's not in adenomyosis month, it will still take place. But I
Good.
just felt really disheartened towards the middle of the month because there
Mm.
was not many people doing anything about adenomyosis.
Anything? Yeah,
Yeah, I just
I
not
know.
gave up, but still put out the information, but it's just all very disheartening.
Yeah. I'm sure it'll be better next year.
Fingers crossed.
Thank you so much for joining in. Really appreciate it. We appreciate your
Thank you for
time.
having me.
Yeah. And we're sending our greetings to the family, to the men in the house, your husband and your son.
He said thanks, good night. My son can't hear. He's in
Okay.
his room, but
Okay.
yeah, thank you.
Thank you so much for joining in. Really
Thank
appreciate
you.
it. You take good care, and we'll be looking forward to everything that's coming.
Oh, lovely. I'll speak to you soon.
Speak to you soon. Bye.
Bye.
Bye.